Hi, folks. This is Dr. Rob CYWES. I am the carb addiction doc. And, when we're dealing with carb addiction, when we're dealing with addictive behavior, a large part of what we deal with is endorphin management, of developing healthier, more effective ways to manage emotional distress, emotional tension, anxiety, stress, depression, a variety of emotions. And how do we make our use of endorphin activating substances beneficial rather than harmful to us? So obviously in the space that we work, our patients have all developed a relationship vicariously with carbohydrates to the point of toxicity, to the point of harm, to the point of the loss of control. So that's what defines the addiction. And as part of that, obesity is a common problem, diabetes is a common problem. And so into this video and the next one, we are going to explore one aspect that is heavily affected by carb addiction, and also as you recover, becomes a very beneficial source, part of the diversity of healthy emotion management. And yet it can also become a very unhealthy surrogate in the wrong way. And it's a taboo subject. We're going to talk about sexuality. And in this video, we're going to talk about female sexuality. And I know I'm a guy, but as part of the work that we do, two things have occurred in the recent little while. My most brilliant mental health counselor that worked with me for a long time, that gained her foundation in what we do as a practice with carb addiction, is a woman by the name of Christy Overstreet. And Christy was our mental health counselor for several years in our practice. And Christy really bought into the carb addiction model. She and I saw a little bit differently in terms of what we should be eating, but she heavily bought into the addiction side and found her foundation in our practice. And Christy's a few years ago has moved on. She became very, very interested in relationships and relationship behavior and sexual behavior. So this is a shout out to Christy. She and I have talked many, many times. We stay in very close contact. And if any of you have relationship issues, sexual issues with partners, narcissistic behavior issues, Christy is a wonderful, wonderful resource. Look her up on Instagram, Kristie Overstreet. She has a beautiful Southern Georgia accent. She's just a wonderful, wonderful human being. And I've learned so much from her in this regard, and a shout out to Christy. The second thing is, just the last few days, I've had a few patients come into my office, couples and females, all dealing with obesity, all on a successful trajectory. And there was one patient in particular that came in, young woman, interested in starting a family, had PCOS, has done amazingly well with getting rid of that, but she came in and she burst into tears. And she said, I've got this wonderful husband. I've got this husband I love so much. I've lost a lot of weight. I'm doing great. I have no libido. I have no interest, no desire in sex. I want to have a family. I've worked so hard to putting myself in a position where I'd like to have children. My PCOS is in remission. And it was the first point I'm going to make is that it was extremely difficult for her to even talk about it. In fact, I was talking about various self-care algorithms, and we use the CHESS model. And the final S is healthy sexuality. And when I said healthy sexuality, boom, she just exploded into tears. But I'm very comfortable talking about healthy sexuality because it's a large part of what we do in our practice. And I said, wow, that's an interesting reaction. And let's explore that. Let's open that up. And the first thing that people find extremely difficult to do, extremely difficult, and very uncomfortable, is to talk about sexuality. And what I try to do with my patients is to create an empathetic human connection with them, where we have this implicit trust in each other. I tell people, I may be very direct, but I'm never going to be judgmental or critical. Let's put this in front of us and let's sort through this. And it was very interesting talking to this young woman, because in the first place we started just kind of as a neutral space. is we talked a little bit about the science of PCOS, polycystic ovarian syndrome, and how that affects sexuality. Well, it affects your period. Your periods are long and heavy and disruptive and dysfunctional. Your ovaries hurt like crazy if they've got big cysts. In fact, I've had several patients on multiple occasions actually go to the ER thinking they've had a kidney stone or they've ruptured an appendix, but it's actually an ovarian cyst that's ruptured, and it hurts like crazy. Well, that horrible pain precludes them, and that fear of having that pain precludes them from healthy sexuality. PCOS, it's an androgenizing, it makes you look like a man. So more hair, coarser skin, maybe the dark ring around your neck. It's related to insulin resistance. So PCOS, just by virtue of what it does to your brain and what it does to your ovaries and what it does to your skin and your general look, is debilitating for a lot of women. So that's a piece. So we address the correction of PCOS. And PCOS is actually a very difficult, but a very easy thing to understand, more difficult to correct. Basically, it's a consequence of insulin resistance in people who are high insulin producers. Results in infertility, results in disruptive cycles, and causes a higher testosterone, lower progesterone, estrogen hormonal picture. And that upsets the whole sexuality. So we talked a little bit about her recovery on PCOS. Then, more again, from a pragmatic perspective, let's look at some of the medications you're on. And this is important to consider. Review your medications if your libido is low. So we looked at some of the medications, and she was on a GLP-1 agonist. She was on, I can't remember, it was Mounjaro or Ozempic or Trulicity. And yes, those drugs do affect sexuality. They affect libido. They're incredibly beneficial. I didn't know this when I was using them a lot. I didn't use them personally, but prescribing them a lot, and I still prescribe them a lot because they are wonderful drugs in terms of correcting insulin resistance. And we were using it to treat her obesity and to treat her PCOS. But those GLP-1 agonists have an effect on the brain and an effect on the female hormone system as it's correcting itself. That is very, very depressing, suppressing of libido. So if you don't feel like sex, if you don't feel sexually interested, it may be related to the GLP-1 agonist. So I would still use the GLP-1 agonist for a while to make the corrections to the obesity, to the diabetes, but understand that your libido may suffer from it. And then we looked at birth control, and there are certain types of birth control, certain types of female hormone replacement therapy, whether you're postmenopausal or premenopausal. The HRTs may trigger tremendous libido where you can't stop thinking about sex, and I'll come to a little anecdote about that, or it may completely flatten your libido. So, for example, some of the women with PCOS on Depo-Provera or some of the hormone suppressant cycles, well, their libido goes to hell in a handbasket with that. So you want to look at your birth control, and a lot of women, postmenopausal women, are put on HRTs, hormone replacement therapy, by their female doctors, by their gynecologists, or by other doctors working in that space. I try to stay away from the HRTs. They're just too controversial, and it's a space I don't go into, but you've got to look at them. And we measure estrogen, progesterone, and testosterone levels routinely in our blood work. And we get a clue from the blood work as to, okay, your testosterone through the roof. Well, now you're on a testosterone replacement. Or is your husband on a testosterone replacement and it's an androgel that's rubbing off on you? And we look at the testosterone levels, they may be through the roof. Or the estrogen levels may be very, very low. So you want to look at those hormone replacement therapies. And quite frankly, my philosophy is the only value of HRTs in a postmenopausal woman is if you have functional disability. If there are lubrication issues, if there are libidinal issues, then maybe HRT done by somebody who understands it in small amounts may help. But otherwise, you probably don't need to be on HRT. That's my opinion. Other people can argue with it. Leave some notes. But there's one anecdote that I'll tell you is that there was a male gynecologist in Jacksonville, Florida, who was prescribing massive doses of testosterone to his female patients. And he was actually using them, if the story is correct. Now, this story may be embellished very heavily. It probably is, because I'm retelling it. and I do not have firsthand knowledge, but it still makes for a good story and an understanding story. He was using massive amounts of testosterone on his female patients, but he was also a sexual predator. And what he was doing, so the story goes, is using huge doses of testosterone on these female patients, and he was using it as a vaginal pessary, as a suppository. So he was actually the person putting it in. So he'd see the patients on a regular basis, use massive doses of testosterone, which would drive the libido through the roof. And then he was sexually abusing those patients in his practice. He was intentionally triggering the libido and then was abusing them in his practice. So you want to be very, very careful. You want to be very careful about HRT, hormone replacement therapy, who's doing it and why they're doing it. Now, I know that's a radical anecdote, but please be careful about what the HRT does, both in terms of depression of sexuality or making you so hypersexual that you destroy good relationships around you. And remember, the dysfunction. We're already dealing with an addictive population, so there is a degree of sexual dysfunction. And yes, it occurs in females, where females are overwatching pornography or getting into pornography or getting into books that they read as a sexual surrogate, or using HRT to just go ballistic and basically get involved in a whole bunch of sexual situations that may not ultimately be to your benefit. Because when you get involved in sexual situations for the accolades or for the enjoyment of that partner, be it a male partner, a female partner, or multiple partners, that can cause a lot of socio-psychological upheaval and disruption. So sex and pornography can be very heavily abused. We don't ever think of females doing so, but absolutely it does happen. And I'm not critical of various lifestyles. But if you are using that lifestyle, if you're using sex as a surrogate for emotion management, as a surrogate for self-esteem, self-confidence, and self-respect, that can be very problematic. You probably need to speak to Christy Overstreet. But before we go ahead, folks, sometimes we drop out of the optimal range of ketosis, which is about 0.5 to 2. And the best way to get in there is to eat fat, but sometimes we need that little burst. And Sheryl and I have done a lot of experimentation. Ketone IQ is the best product we found to rapidly restore optimal ketosis. Whether you're going to exercise, whether you're working, whether you need to be awake, popping one of these babies in tastes a little bit crappy, but gets you into the optimal range very quickly and keeps you there for 3 to 4 hours. Look at the show notes and you will see a promo code that'll get you 20% off. But let's get back to my typical patient population. And this is what a lot of people don't understand. So here's a person who's done extraordinarily well on her journey, on her weight loss journey, on her restoration of health journey. She's lost weight, her health is improved. She should be feeling fantastic. But one of the things we don't understand, and I do understand this myself, is that that fat person who's lost a lot of weight still thinks of themselves as that fat person. And as fat people, and I know this personally, as a guy, now not as a female, but it's probably worse as females because of how society portrays females. Our body image is awful when we're fat. And don't want to generalize, but the majority of obese people are ashamed of their body image. They may not be, and this is an important consideration, this is an important concept which we'll explore in a few minutes, they may not be as cleanly as they could be. So there's an odor, there's a smell, and then there's the functional part for an obese person. I remember in Jacksonville, I had a woman that came in, she had this awful rash under her panis, under the belly. Where did that come from? Well, she said in order for her to have sex with a partner, she had to use a broomstick that she used to lift up her belly so they could get access. Yeah, that's a bizarre anecdote. And she had splinters from the broomstick that became infected. I know it's a bizarre story, but we don't realize how difficult the function of sexuality is when you're 300-400 pounds as a female. And now you lose the weight and you should be feeling fantastic. You look gorgeous. You should be feeling good. But you still see that fat person in your mind, and she's still ashamed and afraid of her own libido. She's ashamed and afraid of what she looks like in front of her partner. Or perhaps, and I've seen this in my practice, she has a partner that loved her when she was fat because he had a fetish for fat people. I'm not arguing about that. But now that she's lost weight, he's lost interest, and she blames herself. And she's blaming herself for the loss of interest of her partner. It might have been a control issue. Again, Christy Overstreet can talk about that. But as you lose that weight, you look at yourself buck naked in the mirror and you've got some skin hanging. You don't feel sexy. You don't feel the sexuality. You're ashamed of your body. How do we build up that pride in self that says, hey, this is me and you love me the way I am? And you build up your libido because of who I am. And the other thing that happens is we age. We age. Things start sagging. And yes, you can go and see the cosmetic surgeon, or you can live comfortably within your age. And if that person cares about you, if that partner loves you, they're going to love who you are and enjoy a sexual experience with you. But libido is a huge problem for many, many women, and they're uncomfortable talking about it. Your body image is an issue, your hormonal state is an issue, and your partnerships are an issue. Because if you lose weight, it doesn't necessarily mean that your self-esteem grows. We've got to work at that. And an effort-based emotion management system in little increments builds up self-esteem, self-confidence, and self-respect to the point that, hey, I'm worthy. And very often when we're obese, when we're sick, we take what walks through the door. We take the partner that shows interest in us, even though that partner is not ideally matched to us. Often we are victims of a partner that preys on us sexually. And that sense of inadequacy, that sense of I'm not good enough, allows us to accept that forceful, preying, controlling, narcissistic partner as a female, rather than someone that cares about us as a human being and secondarily wants to have a sexual relationship with us. That's the partner you want. And then there are the passive partners who expect the female to initiate sex. Yes, very many men want the female to be the initiator of sex. And if you're uncomfortable, you don't do it, and then it doesn't happen. And then the men are over there taking care of their own business, and the females are left to their own devices. So let's go there. Let's talk about that. Let's say you don't have a partner. Let's say you're not interested in a partner. Let's say you're still growing. You're still losing that weight. You're not comfortable. By all means, let go of the social stigma of self-sexual satisfaction. Find something that works. My good friend and colleague, Jamie Seaman, who's a gynecologist, talks very openly about this, and she helped me to talk openly about this. As a gynecologist, she talks about healthy self-sex. And look her up. She's Dr. Fit and Fabulous. She does a great keto conference every year. It's usually in August in Omaha, Nebraska. But she talks about healthy self-sexual satisfaction, an incredibly powerful, positive, endorphin-releasing experience. Don't be ashamed of it. Find something that works. Don't use it as a surrogate for not finding a partner. But it's absolutely fine to do. Don't be ashamed of it. Indulge in it. Enjoy it. But make it a piece of a diversity of your self-care. Don't go from carbohydrates to sex as a drug transfer, as an addiction transfer. But become empowered, become enjoyful of your self-sex relationship. It's absolutely fine. But there's so many religious overtones, so many cultural overtones, so many social moratoria on that. Embrace it, enjoy it, do not feel ashamed of it. An orgasm is one of the most wonderful, wonderful endorphin-releasing experiences a human being can have. to the point that it can become dysfunctional. Enjoy it. Get there. And if you're a woman that struggles with orgasm, which is very, very common, either with a partner or by yourself, get some help. There are plenty of therapists out there that can help you to enjoy and make that a meaningful experience. Sometimes it's physical, sometimes it's biologic, sometimes it's cerebral, sometimes it's psychologic. But work through that. Every human being deserves to have a healthy sexual component to their life. Makes us human. And I'll argue with anybody that wants to argue with me about that point. So I don't have all the answers. I don't have all the solutions. But I've opened the conversation. And don't be embarrassed. Don't be ashamed. Bring this conversation up. And as a unique individual with you and me as a patient, and with Erin, our psych nurse practitioner, these are doors we should be opening in our journey of dealing with carb addiction. It's a piece of the conversation. And it's seldom had. That conversation is seldom had with your healthcare practitioners because we're ashamed. They're ashamed. They don't know how to do it. They don't know how to handle a conversation. They don't want to step on toes. They don't want to cross boundaries. But when we start to talk about it, when we start to open up about it, once you can talk to us in our space where you trust us and we can explore this, and you talk about it, I'm not going to give you advice. I'm not going to give you guidance. I'm going to be there as a presence to help you to explore it openly within that relationship that we have as doctor-patient. But then if you have a partner, or if you're interested in a partner, that conversation helps you then to have that conversation with your partner. How few of you who have libido issues ever talk to your partner about it? Because you're uncomfortable, because you're ashamed. Your partner is part of this. Have that conversation. And if your partner is no longer sexually attractive or sexually stimulating to you, then you've got to have that conversation as well, not just with your partner, but with yourself. But don't do something stupid. Don't go and have affairs. Don't go and have side shows that are disruptive, that hurt you in the long run. Don't be that person. There's some people that are fine with that, but the majority of people do not want to hurt the relationship with the people that love them or that care about them, their children, their adult relationships. You don't want to destroy those relationships by being that person that has the illicit affair and becomes the destroyer of families. And you know how often that ends up in divorce? If your partner is not satisfactory to you, start thinking about the conversation of, is this partner suited to me? And if they're not sexually compatible with you, very often they're not humanistically compatible with you. But end that relationship, deal with that relationship before you move on. Have the integrity to talk to that partner about how can we solve this problem if the sexual part is one problem and you still love them tremendously and they provide everywhere else. If the sexual part is the sexual distance is part of a social distance with that person as a whole, if the relationship has ended, if it's wrecked, don't step out of the relationship while you're still in it. End the relationship. Don't be afraid to be alone for a little while and then develop other relationships. Those are all considerations. These are all considerations in the libido discussion. And if I know it's uncomfortable, but if we don't have this discussion, if you don't have somebody that can have this discussion with you, you're going to continue to suffer in silence. And lots can be done. But it starts with exploring within the healthy relationship, an empathetic relationship, starting to talk about it, starting to articulate your own thoughts. I am the Carb Addiction Doc, and this is part of emotion management. If you want a consultation with myself, if you want a consultation with Erin, our psychiatric nurse practitioner who works in this realm, text us, WhatsApp us, call us, come in for a visit, 561-517-0642. And if you're interested, there are plenty of therapists that work in this arena. The one that I particularly refer to is Christy Overstreet, Overstreet, Kristie, is her first name. mention that you heard this from me, and see if you can get a visit with her. I am the Carb Addiction Doc. Till next time.